being here today. It is so exciting to have you join us for this third program in the Global-US BrainTrust Quarterly Dialogue Series. My name is Phyllis Farrell, and I'm the co-chair of the Women's Leadership Council and the Global Head of External Engagement for Alzheimer's Disease at Eli Lilly and Company. I'm thrilled and honored to be emceeing this discussion today. I'm thrilled because it's not often that you get to have a panel of such notable women, strong and powerful and smart and passionate about brain health. I'm honored because I can call many of them friends. Today, we will continue on the journey to advance conversations around the mission of Global-US BrainTrust, to be brain powerful at any age. Healthier brains means healthier aging and healthier futures for all of us and the people we love. I think I speak for all of us when I say that we're coming together in a pivotal moment for the future of brain and mental health. And I'd be remiss if I didn't say that I think women are at the center of this, and we have a really powerful voice, and we should use it. So let's do that today. This third Global-US BrainTrust dialogue will examine some of the key issues in Alzheimer's disease. We'll hear from experts to discuss diagnosis and the impact of music on dementia. To lead off, we've asked two respected women who are at the apex of vision on the challenges and unique opportunities ahead. First of all, I'd like to welcome Secretary Kathleen Sebelius, the 21st United States Secretary of Health and Human Services and founding member of the US BrainTrust, joined by my dear friend, Andrea Pfeiffer, who's the chair of the Global BrainTrust and CEO and founder of. They're both going to provide us with some short opening remarks. Kathleen, I'll turn it to you.
Well, thank you very much, Phyllis, and hello to fellow panelist Andrea, and I'm really thrilled to be part of this dialogue today. I think it's important to think about what Phyllis just laid out. Women should be at the front of this discussion. We're unfortunately at the front of the disease, and we often are, if not patients ourselves, caregivers, and we are outliving our male spouses and partners, so that the likelihood of dealing with some of these issues is really important. So women, to take prevention seriously, to look at the new data around how to age healthy ways, how to take advantage of what we know about is really, really important. And having this global dialogue is extraordinarily important. So we share information with sisters across the globe and make sure that we are sharing with communities often who are marginalized and don't have access to regular information. You know, I used to say often to people that the Chinese phrase that women hold up half the sky is true, but we also give birth to those folks who hold up the rest of the sky. So I figure we're responsible for the whole sky, and we should see brain health as that kind of leadership position. 10 years ago, I was part of the group to put the US government firmly involved in Alzheimer's research and in Alzheimer's disease, the first national plan against Alzheimer's. 10 years later, even though it sometimes seems halting, there is a lot that has been done, a lot of progress made, significantly more clinical trials, significantly more money into research, opportunities to raise public awareness. And most importantly, I think in 2021, the addition of a sixth goal to the National Alzheimer's Plan, which deals directly with prevention and brain health. There are things that we can be doing, and to recognize that as a national cause and to bring in the public awareness around that issue is so important. So I'm looking forward to the dialogue with really important experts and scientists. I think that there is a lot of sharing that we can do, and also some optimism about hope for the future and opportunities that we can take advantage of.
Thank you, Kathleen. It's such an honor to be today with you, because when I was sort of starting my career in neuroscience, coming from cancer, I really looked at this NAPA and saying, well, this is really impactful. It will change our way, how we diagnose and hopefully treat Alzheimer at 2025. And this is always around everything I'm doing. It's a daily motivation that this might happen. Maybe it will. So I think what was so important that there were a clear plan. There were 5 points which we want to address. It was in particular important that we don't forget over all the research and innovation in clinical studies the patient. Because at the end of the day, it's the patient care and this helplessness, which is I experience every day when we talk to patient. What do I do? What is possible? How can I better be diagnosed? So it's the patient aspect which is very important. Let me add one more thing. When I was thinking about our conclusion of this dialogue, what are we missing? And I think the awareness, and this is again a point, 1 of the 5, is still not there. And if we can achieve today something with all the very influential women in this dialogue, I think we should go out and say the disease today can be diagnosed. It can be diagnosed early, and everything is being done to really come to this breakthrough. And I think one more time, women are in particular disproportionately affected, but women are also potentially disproportionately driving the cause for hope. And if I start already with that, I think it's so important because that we give this aspect of hope. And I think in this respect, to have today diagnostic tools which can identify the disease early, which potentially opens prevention. And this is what we want to do, because once the disease has developed symptoms, we cannot do very much. So to really look into prevention, how we can achieve that over next years is something which is extremely important. And with that, I just thank you so much for what you have done in your function as Secretary of Health and Administration. I mean, your work has been recognized worldwide. I can assure you it has been recognized in Europe. It's one of the standard, I wouldn't call it dictionary, but a standard work which we look up when we are trying to actually establish plans. And since last night, it's copied. So also the Parkinson Society actually takes it on and tries to create something very similar. So with that, thank you so much for your work. And with that, I hand back to Phyllis.
Thank you to you both for your opening comments, but also to both of you for leading on both the public sector and the private sector, which I think is a really important question that I'd like to flip to you. You know, we've been living with a global pandemic. I think COVID-19 has shown us how small our world really is. It's been a tragedy. By the same token, I think there's things from this that we have learned and that we want to keep. And so one of them is this public-private sector collaboration, which we saw in the battle against the COVID-19 pandemic. You know, Alzheimer's disease is a pandemic in and of itself, and it's a slower moving one than COVID, but it's actually more fatal. So how can we take what we've learned from these efforts and apply them to this silent pandemic of Alzheimer's disease? Kathleen, do you want to take that one first?
Well, I think it's a really important question, and I want to loop in some of what Andrea started with. First of all, awareness is, I think, still a barrier, and it's a barrier to moving at an accelerated pace. And I think the addition of the 6th goal to the national plan, when it recognizes that we need to promote healthier lifestyles, we need to identify risk factors, and then work hard on reducing the risk factors, there are things we can do. So that, I think, will be very helpful to a lot of people who just saw Alzheimer's as a sentence, you know, that once you got the sentence, it was basically a fatal sentence. And so we don't want to talk about it. We don't want to deal with it. We don't want to acknowledge it. what I think we also need to look at on the public-private side is that while there was dazzling advancements with mRNA vaccines and clearly an effort where the government worked to take down barriers, fund possible vaccines, put money on the table, be a willing buyer, and the private sector stepped in with innovation and ideas, this wasn't new. mRNA technology was actually developed in the 60s, identified in the 60s. It was tested in mice in the 90s. So we look at what happened with the vaccine, which was dazzling, and to have effective vaccines against COVID as quickly as we did was a terrific accomplishment. But this had been decades in the making, lots of sciences, lots of failures, lots of people who had been told this is never going to work. And I think that in some ways should give us hope in this space, that we are in a space where research is increasing, where clinical trials are really increasing. We have 400 clinical trials last year versus 58 a decade ago. So, I mean, there is a world of research underway, but there is trial and failure. And the public-private collaboration, the investment of the private sector and the government continuing to put money in, be a willing buyer, make sure that we're taking barriers down where it happens, is the way I think we can get to an achievable goal. And, you know, the goal of 2025 is looming fairly quickly, but I'm not discouraged that that immediate challenge is before us, and that you know, between the government efforts and the private sector efforts, I have confidence that we can, you know, make huge progress by that initial goal.
You know, your analogy of the mRNA vaccine is such a good one, because we do really have that same situation in Alzheimer's disease where, you know, it looks like a failure because a study doesn't hit a primary endpoint, but what you learn grows your understanding of the disease exponentially. The problem is those learnings tend to stay with a very small group of people. You know, the scientists, they don't necessarily they're not understood by the community as well. Andrea obviously is an expert in this, sitting as the CEO of a biotech firm that's invested significantly in research here. Andrea, anything you want to add on how we tackle this silent pandemic?
Yeah, there is one thing which personally, again, is very intriguing. As you know, the RNA technology was existing, as you rightly said, but it needed the mind of one or two people to actually apply it to the pandemic we had. And what I'm in particular proud and happy about it is being sort of grown up in the two worlds, so America and Germany, was that it was one of the few projects where I saw Germany, so the Germans, working with the Americans together, creating everything possible, using the government, the Gavi, and everything possible, and in particular to work then with big pharma to assure the distribution, the manufacturing. So it was really a collaboration between private and public, but it was this global approach which made it successful. And this is, for me, one of the most important aspects which we should learn about Alzheimer. Because unless we bring, of course, private and public together, but that we would really take a global approach. And George Vandenberg, who has done so much in the field, I always, when we met the first time, I said, George, I'm ready for everything, but it has to be global. And this is also why this dialogue is a global dialogue, because I believe that there is so much which we can share and must share in order to have this breakthrough.
Well, I can't thank you both enough. I actually could keep going with this dialogue, but given that we've got other great speakers on here and we'll be bringing you back in if we've got questions, I'm going to hand it over to you, Andrea, because you've got the introduction for our next speaker. Kathleen, don't go far. I know we're going to have some questions for you as well.
Okay.
Yeah, so it's again a big pleasure to go now to the next subject, which is Rhoda's work on biomarker. And in fact, when we just had the AIC conference on Alzheimer in San Diego, and I was really, really, really happy to see that the subject of biomarkers becomes almost at the center of our research, and that we're speaking about biomarker-based development, biomarker-based even approval, and that we speak about biomarkers as potentially being able, and this is extremely important, to identify people at risk. Because as I said at the beginning, we want to prevent this irreversible damage of the brain. And this is only possible if we can diagnose the disease early. So one of the top and world experts is Rhoda, and she will help us to look into biomarker. And she corrected me. She said it's precision brain health, not precision medicine. And I took this into my wording. And in particular, she will speak about the future, which is digital technology and what it can contribute to get faster, potentially better, cheaper to the right diagnosis in the right patient population, with the right drug to hopefully go for prevention. Rhoda is a professor at Boston University School of Medicine and Public Health. She's a co-PI and director of the Framingham Heart Study, Brain Aging, and we are learning on a daily level from that study. And she's director of the global cohorts at the Davos Alzheimer Collaborative, which is another initiative which I believe in the Alzheimer field is unique. And maybe if you have a bit of time, we can speak briefly about it. But what is extremely important is that we create this cohorts, which allows us to look at diversity, at longitudinal effects, etc., etc. So, Rhoda, thank you for joining us. So maybe because it's not necessarily a scientific audience, you could explain to the audience what you mean by precision brain health, biomarkers, and in particular digital biomarkers, and how these digital biomarkers can help us to accelerate actually treatment and prevention in Alzheimer.
Sure. Thanks so much for having me. So maybe I'll just step back for a second and, just point out that biomarkers in general it's a term that is tied to disease. And that is currently driven by this medical model where there's this focus on precision medicine. And that's really where I think a lot of what's happening in the digital biomarker realm is also adhering to. Now we want to contrast that with precision brain health, which I think is really about monitoring and intervening across the entire spectrum of normal to disease. And it's really focused on optimizing one's brain capacity, regardless of where one falls on that continuum. So rather than finding the right treatment for the right person at the right time to treat or cure a disease, it's really about finding the right solution for the right person at the right time, and includes keeping, a person within their current state, even within that realm of normal. So that's just to, give some framework as we're thinking about the concept of precision brain health and where I think digital biomarkers might fit in.
Thank you. So where do we stand today in terms of digital biomarkers, and what prevents us from implementing them much faster than we do?
Sure. I mean, I would say that right now, what we're doing in the digital biomarker realm is relatively modest compared to what it could be. So for example, we're largely centered on active engagement technologies, and I would say we're staying within our comfort zone of what we're familiar with. But our technology is really supposed to be doing more than just a better version of what we're already doing. It's really supposed to take us to where we've never been. So in the realm of the current state of the science, we've been having amazing advances in the realm of AD biomarkers, with the amyloid, tau, and neurodegenerative biomarkers, and moving from increasingly scalable possibilities, with now this emergence of regulator-approved plasma biomarkers, which is really bringing the possibility of AD pathological detection to the realm of routine clinical health exams. But neuropathological studies have told us that having the pathology is really not sufficient for clinical expression of the disease. And there's actually scores of people that live their life, seemingly cognitively intact, despite having pathology in their brain. So where I believe digital technologies are really going to take us, and particularly digital biomarkers, is into the determination of who is showing risk for clinically expressed disease versus clinically silent disease. And a digital biomarker of AD that represents clinical expression at its earliest stages is when all the emerging interventions will be most effective, is really where I think is the holy grail of what digital technologies should be enabling within this AD space. And so anyways, but I do think that, to the question of, so we have these technologies out there, why is the progress really moving at such a slow pace? And I think that there's really three primary barriers. So first is this adherence to the past, that, that's what much of what is called digital biomarkers today largely looks like. And it's what we already do. And we're using it to mimic and enhance, and that is perpetuating research through our peer review system, where precedent is really required to pass muster. And, the other problem is our regulatory system, in terms of bringing things to commercial market, requires approval. So in the US, all digital tech companies are really following this path of approval and those gold standards, which were developed on old tried and true methods. So these two issues are leading to what I think is a third barrier, which is the lack of investment appetite for anything that doesn't hold up to either of these two mechanisms, these yardsticks.
Right.
So I think I actually would encourage us to look to the space exploration community for how do we now set up a roadmap for putting a vision beyond what is in our sights, establishing a safe harbor for failure with the knowledge that the path to success is actually through lots of lack of success. And then on making bold investments that will support both the effort and time it's going to take to get there. It's actually going to cost us more and take more time to get to this future vision of digital biomarkers that will eventually be low cost and time efficient.
Mhm. In fact, this was exactly one of my questions. What has to happen on the regulatory side in order to move this together? How does industry, academia, regulators have to work together to get the acceptance and potentially also the approval? This was really, for me, this is one of the key questions, because without that path, we will not get the money, we will not find investors to support what needs to be done. This is exactly one of my major concerns. Speaking about concerns, so when it comes to critical privacy, bioethical issues, how do we deal with them today? How can we sort of make sure that the people feel comfortable?
Sure. I mean, just in research in general, obviously privacy and ethical considerations are pretty much always the most important issue that we have to address first and foremost. And I think in the digital realm, what we've seen, hear about repeated breaches of, information within the research space. Certainly digital technologies right now are adhering to what, HIPAA compliant thresholds, and many of them embed encryption across, the data acquisition pipeline to make sure that no meaningful information is garnered in the event of a, possible data breach. But I do think moving forward, in terms of reaching this objective of accurate detection and monitoring of at-risk symptoms, the current privacy confidentiality methods are probably not going to be sufficient to really meet, these ethical moral standards, which it should be a higher bar and is a higher bar than just legal standards. So for me, the vision is to have a personalized monitoring internet of sorts that provides only information to the person. And that there are information sharing tools that are robust enough that the person can actually pick and choose what of their information is shared and with whom. So, today blockchain technology shows promise, I think, for enhanced data security that could apply in the research setting. In the future, I personally tend to look to both the financial industry as well as the military, because they're continuously producing privacy security solutions for digital that could be applied in this context. Actually, I discovered blockchain through a fintech conference, which was actually in Hong Kong. So, and I think what's happening in the cryptocurrency world is something that I follow with interest, because I think that there are some solutions embedded in there to maximize privacy for the individual. And I think we need to pay close attention to those possibilities.
Yeah, so if we sort of overcome some of these issues, which are really issues, I mean, to speak to the people, that's the first time they mention. So what keeps us away from starting to introduce digital biomarkers in the routine checkup, the annual checkup, starting with 45 or something like that? Are we there? Can we today, like in cholesterol and statins, can we already sort of routinely apply these biomarkers, or how much validation do we still need to do? Because at the end of the day, I mean, I was recently talking to my cardiologist, and he said the impact statins had on heart disease is just absolutely incredible. There are millions of people saved every year. So what needs to happen in order to bring this forward?
Yeah, I think, one of the things that we're a little bit tied to, again, was what I referred to as this concept of digital biomarkers, more in the realm of how we think about traditional biomarkers. And I think that that's holding us back. I actually think if we're going to get to this idea that we can bring this into clinical care, we're going to have to do this with high, accuracy, right? Diagnostic or prognostic accuracy. And the reason we're having trouble getting there is because of the heterogeneity of the symptoms that we're following. So I actually think that what's holding us back is that we need to think about a new class of digital biomarkers that's really going to meet the clinical threshold of accurate early detection. And the reality is it's not going to be one device, one application, one algorithm. That's just not going to get us there. For me, in my mind, I think it's going to be a mix of different sensor data that's going to come together in very dynamic and fluid and really constantly changing mixes of signal that reflects the known heterogeneity of the cognitive, behavioral, and functional symptoms. But nonetheless, when seen in the gestalt, will provide a true representation of change that's highly accurate. And I think that that's a reality that we're going to have to understand, embrace, and then work together. So I think, certainly within the US, the FDA needs to help lead that call. And then I think that then with them sort of showing that leadership, I think then the public and private side of this will then start to follow their lead.
Thank you, Rhoda. I'm sure we could have had another hour of discussion, but I need to hand back to Phyllis to introduce the next speaker. Thank you so much.
Yep, thank you.
Thanks to you both. And thanks, Rhoda. It's always a pleasure. Even though we work together on DAC, I learn something every time. So I knew this was going to happen. I'm probably going to make my organizers nervous as a moderator, but we've got a great question for Kathleen. And I had kind of teased that out there. I don't know if we can get Kathleen back on camera. Oh, it worked. Yay. Okay. My moderators who put together a beautifully run of show are probably gnashing their teeth at me right now. But Kathleen, I couldn't miss the opportunity. George Vradenberg had posted a question in the chat. And, we're also honestly proud and I think humbled by your creation of the NAPA Advisory Committee and all the vision that you brought to that with our national plan for the United States. And obviously it's had an unquestioned impact on the federal government, Congress, executive branch, funding. But in your opinion, has it engaged the business and the NGO sectors as you might have hoped 10 years ago? How far did it come in your vision, and what would you be hopeful for now?
Well, I think that's a great question. Could there be more engagement? You bet. I do know that even in my tenure at HHS, which I left the department in the summer of 2014. So just to put that in perspective, we were already in some global dialogue. Particularly Great Britain was moving ahead with lots of research, and we were doing collaborative projects with them. There was research going on in the G20 countries because this whole issue of Alzheimer's and dementia was beginning to be a factor really all over the globe. So that dialogue was beginning at that point in terms of a global mission. I do think the number of clinical trials indicates also that there has been a great expansion in engagement with, private sector partners and with researchers. But could it be more? You bet. The government now spends about 4.5 times as much money through NIH grants as they did 10 years ago. That's good news. I think we need to challenge also the private sector to, step up and to say this needs to be part of your portfolio, not waiting until there's a breakthrough on the government side and then commercializing the drug or the opportunity, but really putting some R&D money in at the very front end and doing that. Andrea talked about Germany and the United States collaborating on the COVID vaccine. I think that kind of effort needs and could certainly happen. I'd be remiss, though, if I didn't give a shout out to George Vredenberg. As a single individual, I can tell you that the national plan probably would not exist if he hadn't been incredibly focused and tenacious. And we had an opportunity to work closely together around framing that. It was, in some ways there's a reluctance in government to call out one issue or one disease, because there are always then lots of people who say, well, what about us? You forgot about us. This was so compelling, and the information was so compelling. I think it really took that sort of effort, but having now that marker in place and being able to measure, here are some goals that are set out. Here is how much money was being spent. Here's how much money is being spent. That kind of measurement of progress and accountability to both patients and their families and the whole community, I think, is absolutely critical. And George is uniquely responsible for just driving that effort within the federal government.
Well, we all know that George is very hard to say no to. So I'm personally thrilled, as someone who's been impacted by this disease in my family as well, that he's on the charge. You mentioned the public-private collaboration again, and I think, you're right. COVID was that thing that made everybody come together. I think Alzheimer's is that thing as well.
Yeah.
One of the first NAPA investments was actually the A4 study, which I think was, to my recollection, one of the largest public-private partnerships that had ever been engaged. An almost 10-year study now in secondary prevention of Alzheimer's disease. One more question while I've got you on NAPA, because I think it'll set up the second half of our program today. And that is specifically around the sixth goal. Both NAPA has set out now a sixth goal around lifestyle modifications. The World Health Organization has set a goal to reduce dementia by 40%. We're going to talk about a couple of potential interventions a little bit later here today, but any thoughts that you'd like to provide for the group on that sixth goal and as we set up this next half of the conversation?
Well, again, I think, first of all, adding a goal is an indication that the government is still very focused on this and felt that with what has been learned in the last decade, 5 were not enough. We need really a prevention goal. We need the genetic information is now much more robust than it was 10 years ago. The biomarkers are much more robust. So being able early on to identify risk factors and reduce those risk factors. As Andrea says, once you have the symptoms, unfortunately, there's not a lot that can be done or has proven successful, but identifying what might be the high risk factors leading to symptoms and working out strategies and information and efforts to, I mean, high blood pressure seems to be a correlation. There are indications of other possible correlations. So having that information and then driving that information into not only, Medicare, which can play a huge role in promoting checkups, changing the way that doctors are graded in terms of the physical exams that they give to people, adding some factors that actually make sure we're checking on indicator. I mean, there are lots of dots that can be connected once we have that goal in place, and really drive an accelerated look at how you work on prevention, how we spread information on prevention, how we get out ahead and involve not only the private sector on the commercial side, but the health providers who really are dealing one-on-one with a lot of folks and saying to people, by the way, your high blood pressure could lead to this and this and this. We've always talked about links with cancer. We've always talked about links with we've never talked about links with brain health. And I think that is a huge breakthrough.
No, I love it. And you're bringing forth yet one more analogy, which is treating Alzheimer's disease as a public health initiative as well as clinical medicine. So thank you for allowing me to change things up a little bit. I know that I and the rest of the group wanted to hear a little bit more from you. I'm going to transition, and thank you for everything you did with NAPA and continue to do for us. I'm going to transition right now over to Brooks Kenny. Brooks is the Vice President of Consumer Engagement and Partnerships at the Us Against Alzheimer's organization. She's going to discuss Brain Guide. It's a first of its kind web and phone-based platform that's been developed by Us Against Alzheimer's that empowers those living with cognitive impairment and their care partners with free knowledge and resources. Brooks, coming to you. Thanks for being flexible with us.
Great. Thank you so much, Phyllis. And I can honestly say that today is a career highlight. I've never believed I would be following Secretary Sebelius in a conversation. So thank you again for being with us today. I just want to pick up on one of the comments that she made around providers. You know, here at Us Against Alzheimer's, we really believe that we have to have an impact around prevention and early detection on the system side, and the policies need to be in place. But we also know that providers, and in particular, primary care providers, nurses, healthcare practitioners, really need to be well-informed about risk reduction, about brain health. We've recently launched a Brain Health Academy where every month we're educating upwards of 1,000 different healthcare practitioners about the risk reduction guidance that we have now created and based on the Lancet report. So we are completely in agreement that the provider community is a big, it's part of the 3 legs of the stool. And then the third is consumers. We know that if we can create consumer demand and we can invite people to feel empowered to start talking about their brains as a vital organ, that can help with the system change as well. And as many of you know, we launched about 4 years ago now, the Be Brain Powerful campaign, which was a women's focused campaign designed to basically give women a tip every month about what they could do to have a healthy brain. And at the time it was very innovative, and there was nothing else like it. It was based on research. We launched it in Switzerland as well, working with the Women's Brain Project. And it's been a really great testament to getting women the education they need. That has morphed into the development of a much broader program, as Phyllis mentioned, called Brain Guide. And Brain Guide was built using assessments that exist in the clinical setting today, working with medical experts, working with community leadership to essentially provide consumers the opportunity in a very private, safe, and free way to test their own memory using a memory questionnaire. It's based on validated tools that exist, as I said, in the clinical setting today. It exists in both English and Spanish. People can take a memory questionnaire for themselves, or they can take the version that's designed for caregivers of loved ones that they see often. And we launched back in March of 2021. And to date, we've had nearly 300,000 people take a memory questionnaire. And what's unique about Brain Guide is that it allows you to get custom resources based on the answers that you provide. So we have multiple algorithms and technology on the back end that allow folks to take the memory questionnaire, answer some of the questions in addition to the word test. And then we provide you with very tailored information based on your responses and how you do. And what's been remarkable to see is that, perhaps not surprising, about 78% of the people coming to Brain Guide are women. Most are between the ages of 60 and 85. About half are self-reporting being concerned about their memory. And of those, 78% score poorly, meaning they are not able to remember all 4 words in the word test. And so we direct them to very specific resources and empower them to talk to their doctor. We wanted to inform this dialogue with this resource because it's just one way that we're trying to spark the conversation and get more people into a discussion around early detection and also around prevention and risk reduction. So we would welcome anybody, give it a try. You can go to mybrainguide.org or call the 800 number on the screen, and we welcome your feedback. Today, it's available in English and Spanish, and we're hoping to add more languages soon as we bring this to the global stage. So thanks for the opportunity to share more with the group today, Phyllis.
Thank you, Brooks. And I know that there's lots of us that want to go out there and play around a little bit with that as well. So I am now excited to invite Sarah Locke. So Sarah can come off. There we go, her camera. Sarah is the Senior VP of Policy and Brain Health and Executive Director of the Global Council on Brain Health at AARP. And she's going to discuss their recent report on us, or report with us on music and brain health. And then my hope is that Kathleen's willing to come back on again, as she will be joining us in our conversation. So Sarah, back first to you. We're thrilled to have you with us today to share more about the Music on Our Minds report and show how music can potentially help treat brain conditions such as dementia and improve overall brain health.
Thank you, Phyllis. It's great to be here, and I'm excited to participate with the Global BrainTrust on this conversation. AARP has been a part of the Women's Brain campaign for since it started, and having the opportunity to work with all of you is a great pleasure. I'm going to try to share my screen with some slides. So let's try that. Okay, is it showing up all right?
We've got you.
Terrific. So I'm all the way scrolled down to the bottom. Thank you. I wanted to tell you that the brain report that I'm talking about from music is the work of the Global Council on Brain Health, AARP's collaborative that we've been supporting 200 plus brain health experts from around the world working on areas of brain health of interest to older adults. You can see here that we have people from all over the world, but I wanted to give a shout out. I see that there are quite a few people in this conversation that we're having today in the chat on the participant list that have been liaisons or help to the Global Council on Brain Health. So it's great to see you all here. But the Global Council on Brain Health tries to address areas of interest around the science behind what works and what doesn't to impact your brain health as you age. And so you can see here this picture of the experts that joined us right before COVID hit. It was the last meeting we held at AARP, members of our governance committee and issue experts in a moderated by Dr. Sanjay Gupta, where we were able to do a deep dive on the science behind whether music can actually impact your brain health. And you'll see our report is available on the website, and I put it in the chat if you want to take a deeper dive into some of the scientific research behind the very high level information that I'm going to summarize today. So it's interesting, we were talking about the decades of research that are necessary in science and technology before you can begin to implement it and use it to change outcomes for people. Music is something that we've known about for centuries, and it's something that almost innately we understand it can be helpful for us. But you may not realize that music has incredible powers to stimulate your brain. In fact, during the work that we did on the music report, people were constantly remarking that there's nothing else that simultaneously affects more regions of your brain all at the same time. We know from the existing science that it can promote mental well-being, and it stimulates your thinking skills. Music from the perspective of prevention encourages movement and exercise. It makes everything you do to reduce your risk for cognitive decline, whether that's exercise or social interaction or cognitive activity. Music kind of greases the skids, if you will, to encourage those healthy behaviors. But when you look at its effect on the body, you can see that it helps regulate blood pressure, heart rate, and actually reduce stress. Some of the biochemicals in your body are actually affected and have been studied when you're looking at music on the human body and on the human brain. One of the questions people always want to know, is there one kind of music that is better for the brain? Is there a particular style? Everybody has heard about music for babies, for Mozart, for baby in Euro. Well, what about musical styles? Well, it turns out that whatever genre of music you like and speaks to you can have beneficial effects. ARP, along with bringing together scientists from all over the world, does surveys of people, in this case, these were adults 18 and older, to look at what they preferred by age group. And you won't be so surprised, but if you take a peek at this, when you look at the most popular genres by age, these are the genres that really speak to these generations. But there's a lot of heterogeneity amongst people, and music is a very personalized kind of experience. I mentioned the survey that we did. Over 3,000 people, a nationally representative survey of adults 18 plus, in which we were able to also look specifically at African Americans, Asians, and Hispanics. But what was fascinating is that there were not such big differences by racial or ethnic groups, but there were some differences in people according to how much they actually currently and in the past have engaged in music. And we found an interesting association, which we're not saying it's causal, but we found over and over again that people reported a higher brain health and better mental well-being, lower average levels of anxiety and depression, and above average mental well-being scores if they were regular users and consumers of music. And here we're talking just listening to music, not even necessarily playing. So the council looked at the existing science and made some very specific recommendations, encouraging people to incorporate music in their lives. And that can take almost any form: dance, sing, movement, participating in music, whatever speaks to you and engages you in music. And listening to familiar music is important because it brings back good feelings and mental well-being and familiarity. But try to expand your horizons and think about listening to new music in ways that gets your brain and your synapses moving in slightly different ways. But perhaps the most powerful impact is making music yourself. Now, you don't have to be Ella Fitzgerald in order to sing. You have to be somebody willing just to engage in the act of making music, and that can have a powerful effect on your brain health. Now, I see I'm just down to 25 seconds, so I wanted to quickly go through the rest of my slides and say I'm happy to talk about this more in depth in our conversation. But community-based groups such as Encore, incredibly powerful, both for its socialization and its impact on brains. Virtual platforms and social media can also be beneficial. Okay, that's my high sign of warning that it's almost time. So music therapy is useful both in physical and mental health conditions. And the relationship of music and movement are particularly important and have been shown to have demonstrated benefits in neurodegeneration and recovery for stroke, for example, learning how to speak and move again. Helping to connect and strengthen caregivers, reduce anxiety and behavior, we found positive associations in the treatment for dementia. And we wanted to emphasize that no matter your age, no matter your physical conditions, music improves mood and encourages social connections, benefiting patients and caregivers alike. Here's more information. It's available in English and Spanish, infographics in multiple languages. And I wanted to say, because we want to talk about policy, we're going to talk a little bit more, hopefully, about the NeuroArts blueprint and how to advance the science around music and brain health. Thank you.
Sarah, thank you so much. And each one of these topics actually could have taken the full hour. But I know you put the report in the chat, and there will also be a follow-up email that comes to everybody that registered that will make sure that the link of the report is there. And maybe you'd be willing to share those slides since we didn't get to spend quite as much time on them. I'm going to ask Kathleen and Rhoda to come back on, and Andrea, I think, as well. Do I have everybody? So just to let everybody know, we're going to kind of close things up now, but as I mentioned, you will get an email. Everybody who's registered will get an email. In that email, you will be able to hear about the next Global Brain Trust Quarterly Dialogue, which is happening November 22nd. Looking at collaboration of women in science, media, and philanthropy. You'll also be able to join the BrainWire newsletter, which is a good way to stay in touch with everybody. And then please join more than 150,000 people who've already taken advantage of My Brain Guide, which is www.mybrainguide.org. All of this information is going to come to you in email. I'd rather give the time for closing remarks to our panelists. Sarah, since you just went, I won't call on you first, but we have one final question for each of you. I want to know what conversation you think or you hope that we will be having 5 years from now. Rhoda, you're nodding. I'm coming to you first.
I am an optimist, and I really think that we're going to be at the level of people talking about how is my brain doing and going to their primary care, either to ask for, I need a brain check, or bringing their data with them, right? And saying, here it is, what can I be doing to keep my brain either at this level or make it better, right? And that's where I really, really think we're going to bring this down to the individual.
I love that. We know that women are the chief medical officers in their families, so they'll be doing it for themselves, or they'll be shoving their husbands out in front of the conversation. Andrea, how about you? Where do you think we're going to be in 5 years with this conversation?
Yeah, I think I will work with Rhoda together while she's looking into the biomarkers and how we can identify people at risk. I would like to work on the sixth goal of the NAPA, meaning what can we do in prevention? And here I'm not only speaking about vaccination or medication or immunotherapy. As you know, with my background in food, I'm very much interested. What can we do in the lifestyle? How can we better communicate, better educate, again, women to actually stay healthy? So I will have a close collaboration with Rhoda on this.
Well, please invite me because I want to be part of it as well. Sarah, you do have a question in the chat, but I'm going to send it to you to follow up with after. So how about where you think we're going to be 5 years from now? You'll be obviously playing a new instrument, I think.
Absolutely. It will have been that our government and governments around the world have figured out how to support individuals in their ability to reduce their risk for cognitive decline. And it will be transformational. NAPA will have achieved its sixth goal, and the world will be making a difference for all kinds of people, no matter where they live, no matter their gender, no matter their race.
I love that. Kathleen, back cleanup for us.
Well, I love Sarah's vision. I want to stay tuned on the collaboration between Rhoda and Andrea. But I do feel that bringing this to the level of individuals, giving individuals hope that they can really make a difference, that they've got some choices and that they really can be more impactful on their own lives and on healthy aging and brain health as part of healthy aging. We need to, and we always talked about, mental health should be health, right? We're talking about brain health should be health. It shouldn't be a separate category that's siloed. It is part of ongoing health. And, women need to take the lead and be educators and care providers and take care of ourselves first, because we're going to be around for a long time. So we've got to stay at the front of this game and continue to put pressure on both the private sector and the government to keep this disease, this tsunami that's coming at us front and center, because there are things we can do. We can't take our eye off the advancements that have been made and what needs to happen in the future. So I continue to be optimistic that we can make a real difference, and that prevention is a huge additional goal to work on. But keeping pressure on what are treatments, what are breakthroughs, what kind of scientific evidence do we need to, get to the next level also. And 2025 is around the corner, so let's go.
I love it. And I know that for me anyway, we all want to work ourselves out of a job. And I'm not sure we'll quite be there in 5 years, but I am so much more hopeful when I see the strength of this group and the women around the world that are willing to link arms and solve this problem. We know that when women take on something, we are unstoppable. So for any of you that have not yet joined the Women's Leadership Council, would like to, please stay in touch with us. Let's link arms and do it. We'll just build a bigger boat if we need one. There's room for everybody. So thanks to all of you, and thanks to Us Against Alzheimer's for hosting our Global Brain Trust today.
Bye-bye.
Bye-bye.
Thank you.